If you constantly experience flushing or persistent redness on your face, you might have a skin condition called rosacea. It affects over 400 million people around the world, and most aren't even aware they have it. Rosacea often comes with acne-like breakouts and the appearance of broken blood vessels on the face. It's not contagious, but it obviously affects a person's social anxiety as well as their emotional health. The good news is, there are many things one can do to decrease the regularity and severity of the flare-ups. On the program today, we'll talk more about rosacea, including how to manage its symptoms and avoid flare-ups. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk on CNN Philippines. Rosacea is a chronic inflammatory skin condition generally associated with constant blushing or persistent redness of the face. But there are many different types, and it can manifest on the skin in unique ways. Let's welcome to the show Dr. Peachy Paz-Lao from the Makati Medical Center, and we also joined by Dr. Ces Rojas Rosete from the Medical City Hospital and Rizal Medical Center. Dr. Peachy, what are some of the risk factors pagdating dito sa condition ng rosacea? And do Filipinos actually have to worry about it?
They're more common in women and 30 and above, over the age of 30 and above. Textbooks would say it's mostly seen in fair-skinned individuals and European descent. But I guess because we're a mixed race now and we have a lot of our countrymen who are very fair, so we cannot totally say that we cannot see them anymore in Filipinos because of our dark skin, because we have a lot of fair-skinned also in our country. Also, it's genetic. If you had the history of acne, or probably a coexisting autoimmune disease. And sometimes lately they've been kind of attaching it when you have H. pylori in your GI tract.
Now, Dr. Ces, since most people aren't even aware of whether or not they have this condition, what are some of the overt symptoms that rosacea may have?
There is this temporary, initially reddening of the surface of the skin of the face that can be very persistent over time. Now, aside from the redness, the patients could also develop bump-like lesions on their skin. Some can be pus-filled, similar to acne. There can also be visible veins on the face because of the overreactivity of the cutaneous blood vessels, so they dilate pretty fast. Now, there could also be burning sensation in some patients. And over time, if this is left untreated, there could be thickening of the surface of the skin, leading to, let's say, especially on the nose, among men, it could become enlarged and bulbous in a condition which we call as rhinophyma.
Dr. Peachy, are there specific conditions that can trigger flare-ups?
Top 3 would be sun exposure, stress, hot weather, also strong wind, heavy exercise, sauna, a lot of alcohol drinking, cold weather, spicy food is a trigger, very hot humidity, and even caffeine.
Dr. Ces, I want to talk about these flare-ups and how they can affect a person's self-confidence. Ito yung importante dito eh. How often can this happen? And could you tell us more about this?
Rosacea can be pretty distressing for a lot of people because especially when the redness of the skin and the bump-like lesions are very visible and very persistent. This can be a source of embarrassment to the patient because it's really on the center of our face. So when people would talk to you, they would see it immediately and ask questions. Therefore, it is really necessary that at its early stage, it can be addressed properly so that it would not go to the severe stages and would receive treatment and control.
Because many people aren't aware that they have this condition, it's often confused with acne. Dr. Peachy, how can one tell them apart? Kapag merong namumula sa mukha, may konting bumps, pus-filled, how can one determine if this is rosacea or acne?
Sometimes it can be very difficult because they overlap. But probably the most common would be acne, would usually have whiteheads and blackheads. And if there's redness, it's just concentrated around the area where you have your specific acne. Also, with acne, you can have nodules, and you can also have acne associated on the chest and the back. Now, if it's rosacea, number one, sometimes it's not anymore responding. If you think it's acne, it will not really respond to the acne treatment. And in rosacea, there will be no blackheads and there will be no whiteheads. It's usually just diffuse redness, and the redness is not only on the acne lesions but diffuse, usually in the central part of the face, and then you would see some veins.
Pero Dr. Says, ang tanong is it possible para sa mga merong acne naman sa mukha, pwede ba silang mag-develop into rosacea, yung mga madalas magkaroon ng acne?
For those people with acne, it is still possible if you have the genetic tendency to developing redness on your skin, meaning if you are a natural born flusher and blusher, no? Most of the time, the natural progression would be patients with rosacea may develop acne-like lesions. That is the more natural progression. But for patients with acne, only those with a genetic tendency to redness of the skin would develop rosacea as well.
When we return, we'll go through the various types of rosacea. So stay with us on Med Talk Health Talk, only on CNN Philippines. I'm Dr. Freddy Gomez, and this is Med Talk Health Talk on CNN Philippines, where caring is our calling. Chronic blushing is what most people characterize rosacea by, but its symptoms are so much more complex than that. There are 4 main different subtypes of the condition, and it's even possible to have more than one subtype at a time. Dr. Peachy, tell us more about the most common one, which is known as ETR. So what are its usual warning signs pagdating sa ETR?
ETR, usually they would have frequent episodes of flushing or maybe even permanent flushing. And there would be a persistence of redness in the central area of the face, usually inner cheeks, here and here. There would be visible veins. Veins would usually be seen, and then there would be swelling, there would be burning and stinging sensation, and the patient just is always red.
Dr. Says, let's go through some of the symptoms ng acne rosacea. What can our viewers learn about this subtype?
Acne rosacea is rosacea wherein after the redness, the patient would develop small bumps on the skin. Some would be pus-filled, no? Similar to regular acne. Now, in severe types, there could also be nodules of acne, but that's why when you say acne rosacea, this would refer to patients with starting off with redness of the skin, developing acne-like lesions. No, medically we also call them as papulopustular rosacea, and that's the second stage of rosacea.
Okay. Now, Dr. Says, when it comes to rosacea, one of the symptoms that was earlier mentioned is that burning sensation that someone may have. Where does this come from, and is this a characteristic symptom for rosacea?
The burning sensation of rosacea would usually come from irritation to environmental factors. No, the redness of the skin actually naturally makes the patients sensitive to this environmental triggers. No, example would be direct exposure to sunlight, as well as the use of cosmetic products or skincare products that ordinarily would be okay with the general population. But for patients with rosacea, since they have more sensitivity as compared to normal individuals, then they could have irritation to this product.
Dr. Peachy, let's talk about rhinophyma. How does this develop? How often does this occur? And what should our viewers know about it?
Sometimes you see people walking around like with a very, very deformed nose, and that's rhinophyma. It always occurs in patients who have had a long history of untreated rosacea, usually. They don't really know the exact cause of rhinophyma, but it's always related to chronic untreated rosacea. And usually they're seen in males.
Now, the last type of rosacea is the ocular type of rosacea, and it's similar to the different types in that it causes redness, but instead, this subtype impacts the eyes. Dr. Sess, could you quickly explain this subtype, some of its signs and its symptoms for our viewers to be aware about?
Ocular rosacea would, of course, occur on the eyes, wherein the eyes also become dry, highly irritated. The eyes and the eyelids could be swollen and edematous. And this is actually something that is similar to skin rosacea, which means that if you do not treat it or you do not address it, then it can also lead to what we call as rosacea keratitis, wherein the cornea of the eye can be damaged and can lead to loss of clear vision.
Dr. Peachy, when it comes to newborns having really red cheeks, should parents watch out? Could this be possibly rosacea, or could this be something even more benign?
In newborn babies, no, I don't think it's going to be rosacea. Usually, this would be from hormones of the mother, or probably some trauma or irritation as the baby comes out. And usually, you can even see acne in newborn babies, and you will see some papules, and then the mother would panic and then would think that her baby would have acne.
Right.
These are usually transient, so the redness in newborns, I would say, would be transient. I would probably say that it's due to the hormones that the baby has been ingesting inside the hormones of the mother, so they would come out. Just don't panic. Give it a few days. That would usually subside, and just make sure that they bathe the baby well and properly with very mild facial cleansers.
Ayan, good advice. So for those new parents out there, so you can always have that conversation with your dermatologist if you are still unsure. But ultimately, every case of rosacea is ultimately unique, and your dermatologist is your best guide for the type that you might have. In the long run, though, the condition can affect more than the skin as well as the eyes. It can even reduce a person's quality of life. So how can we diagnose and treat it effectively? More on that after a short break. Your health is our mission here on MedTalk Health Talk. You're watching CNN Philippines. I'm Dr. Freddy Gomez, and welcome back to MedTalk Health Talk on CNN Philippines, your partner in healthcare. Dr. Sess, could you walk us through how this condition is diagnosed? What happens when a patient first consults for possible rosacea?
When a patient consults with first time with rosacea, of course, we do a detailed history and a physical examination. The diagnosis of rosacea is primarily clinical. No, there is no diagnostic test unless the picture is not very clear to us. No, that's the only time we request for additional procedures.
Dr. Peachy, what are some of the medications usually prescribed? Are topicals mainly used, oral medications, a combination of both?
For the bumps that you're saying, there's quite a limitation of treatment because a lot of the medications are not available in our country. But I would say for the papules and the pustules, the one that they see the bumps, you can have a systemic treatment. And the one that's really approved by the FDA is very low dose tetracycline of about 40 milligrams twice a day for about 1 to 2 months. If it's not available, we actually don't have that kind of treatment. You can go for maybe 50 twice a day for tetracycline. You can also have minocycline or even azithromycin. Then for the topical, what is easily available would be permethrin 5% cream and even metronidazole cream.
But Dr. Pichi, what about laser treatment? This is one of the talked about treatments for rosacea. For those who aren't familiar with laser treatment, please explain to our viewers, masakit ba ito? Matagal ba ito? What is the downtime when it comes to treating rosacea with lasers?
There are just specific lasers which you can use for rosacea because the target of the laser would be the redness. So it would be the pulse dye laser, the V-beam. It can be the 585. You can also use IPL. And there's no downtime for this kind of lasers. It's just light flashing and you can just go home. It's very short. The treatment is very short. So we usually have it around every 2 weeks or even every 4 weeks. And lately, they've also been using radio frequency and also light emitting diodes. And all of this have no downtime. And so the patient will not feel any irritation.
Dr. says, is the wearing of mask with those who are affected with rosacea, can this aggravate the condition?
Rosacea can be irritated by frequent and prolonged wearing of masks, because it can produce breakouts, which is similar to acne rosacea. Now, the tips that we can give in order to prevent them, if for, of course, the ordinary individual who are using reusable masks, you have to wash them very frequently with hypoallergenic detergents in order to remove the toxic residues on the mask. Other thing also that you can do is every time you remove your mask, you have to also wash your face. And right after washing, then moisturization. Regular moisturizers would help.
Dr. says, could you talk more about soapless washes or those types of ways that our viewers can clean their face, especially if they have conditions such as rosacea?
Patients with rosacea have sensitive skin.
Right.
So there are many different types of cleansers in the market. We have true soaps, we have combars, we have the Syndets. That's what we call as the non-soap cleansers. And for patients with sensitive skin, the Syndets usually approximate the pH of our skin, which is acidic. So they can effectively remove the surface dirt without stripping our skin of its natural moisture.
Now, Dr. Pichi, does rosacea progress and get worse over time? Is this something that if any of our viewers notices on their face, they should get a consult right away?
It can get worse, okay? Because the flare-ups are the ones that would really make it very difficult for the ones affected with rosacea to really go on with their job because of the burning, the stinging, the aesthetic condition. Sometimes they can't even go to work and face patients because they're very red and it's very uncomfortable.
Now, Dr. Pichi, could you share a basic skin routine for our viewers, for those even without rosacea, how to take care of their skin, especially in their face?
So make sure the minimum number of times wherein you should wash your face would be twice a day. And then if you feel dry, it would be good to use a very good moisturizer in the morning. And always sunscreen. Even if we're just at home, we're always facing our laptops and whatever devices. And there is what they call like the blue light. And so you also, even if you're at home, you have to put the sunscreen to protect yourself from the photo damage that can be caused by the blue light. And at night, of course, clean your face, remove your makeup well, and then use a moisturizer.
I'd like to thank dermatologist Dr. Pichi Pazulao and Dr. Ces Rojas Rosete for guiding us with their expertise on today's topic. Marami pong salamat sa inyo. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk on CNN Philippines. We'll see you soon.